everyone. Thank you for joining me today. My name is Antonio DaCosta, and I will be presenting our study on the association between fall risk scores and 30-day return to hospital rates in older adults who have undergone hip fracture. Older adults, especially those undergoing major surgeries like hip fracture repair, are at a heightened risk of readmission within 30 days post-discharge. Previous studies have suggested that higher fall risk scores are associated with increased morbidity and mortality in this population. Our study aims to determine whether these preoperative fall risk scores can predict 30-day hospital return rates. This study was conducted as a secondary analysis of a quality improvement database, which included over 60,000 admissions of patients aged 75 and older at a 400-bed community teaching hospital between the years 2017 and 2020. We calculated fall risk score using the Johns Hopkins Fall Risk Scale and categorized them into two groups: high, which were scores greater than 16, and low, which were scores equal to or less than 16. Groups based on prior research. Our analysis focused on readmission, observation stays, and emergency department visits within 30 days of initial discharge. Chi-square tests were utilized for statistical analysis with a significance level set at a p-value less than 0.05. Among the 61,193 eligible admissions, about 5% had a diagnosis of hip fracture, and similarly, 5% had high fall risk scores. Within the hip fracture group, 8% had high fall risk scores compared to 5% among those without fractures. Interestingly, we found that high fall risk scores were not significantly associated with 30-day hospital return rates, regardless of whether the patient had a hip fracture or not. However, a significant association was observed between high fall risk scores and a longer length of stay, as well as older patient age. In conclusion, while hip fractures were significantly associated with increased hospital returns, the fall risk scores used in our study did not independently predict 30-day return rates. This suggests that scores may not be reliable for forecasting readmissions in this population. Our findings highlight the need for further research to explore alternative predictive factors and validate these results in a more diverse population. Thank you for your attention. I would like to acknowledge my co-authors, Dr. Gabriella Engstorm and Dr. Joseph Auslander, for their contributions to the study and mentoring me in this study. I'm happy to take any questions you may have.